This is Columbus Community Hospital Healthcasts. I'm Bill Klaproth. In this episode, we talk with Dr. Lauren Jazwick, an otolaryngologist at Columbus Community Hospital, as we discuss chronic sinusitis, sleep apnea, Inspire therapy, and allergies, and how getting the right treatment can improve your day-to-day life. Dr. Jazwick, welcome.
Thank you. It's a pleasure to be here with you, Bill.
This is a big topic, so happy to be here talking with you about this. So, Dr. Jazwick, what do we mean when we talk about sinus problems, allergies, nasal blockage, and sleep apnea in adults, and how are all of these things connected?
From what I see every day, I do see the gamut of what you're talking about. But this time of year, it's certainly very heavy in sinus and allergy patients. From a sinus perspective, when I see patients for that, it's typically that they come in with a couple of different symptoms. And they can range from, I'm really struggling to breathe through my nose. It feels like there's no air moving. It can also involve pain or pressure in the forehead or the sinuses. They can have a significant amount of mucus, or some are even so bad that their smell has been impacted. And with the smell always comes taste. That really is what I'm seeing right now. That goes along with the allergy season, of course. This year, unfortunately, we started a little bit sooner as it got hot and windy sooner. And that has been affecting people, especially with the nasal blockage symptom. And then certainly itchy eyes and ear fluid and all of that goes together. All of those really combine to impact our sleep at nighttime. I have many patients that come to me and tell me that I feel like when I lay on my side, I can't breathe at all through my nose. And that can be an important piece in snoring, which is the noise that we make. But it also can play a really important piece in sleep apnea. Sleep apnea is a medical condition, and it is essentially how many times per hour your body obstructs airflow. And that can lead to a lot of strain on your heart and your brain and your lungs. So that's where they all combine to make more of a medical problem. Sleep apnea is really impacted by our nasal breathing, but it's not the only piece that plays a role with sleep.
Yeah, it is kind of a big puzzle when you put all of these things together. They do combine into creating quality of life issues for people. So what are the most common warning signs that an adult's nasal congestion, sinus pressure, allergies, all the things you were talking about might be affecting their sleep or pointing towards sleep apnea?
Most patients come to me because their bed partner has said something about it. Either they're kicked out of the room or they're no longer sleeping together because the snoring has become so noisy. And that's certainly one piece of sleep apnea is the snoring and the pauses in breathing. That can really make bed partners very nervous. But I also think in relation to that, there's a lot of silent symptoms of sleep apnea. And those can be feeling fatigue throughout the day, falling asleep at the car wheel, having accidents, just decreased quality of life. We also see a lot of medical issues that really key us into whether a patient has sleep apnea or not. Things like irregular heartbeats or blood pressure that's more difficult to control, strokes, heart attacks early. Those are all signs that maybe we need to look more at the sleep as the cause of all of these problems.
It's amazing how sleep can cause these problems and how lack of sleep can bring on these types of symptoms and again, these quality of life issues and even serious medical conditions, as you were saying. So for someone wondering, well, how do I know if I have sleep apnea or maybe it's just bad allergies or sinus issues? Like we said, it's a big puzzle. What are the key steps in getting a proper diagnosis?
I think part of it, and most of the patients I see, it's because their bed partner has said something to them and they finally decide to do something about it. I think a lot of those more subtle signs too, especially the daytime symptoms, just feeling like you can't get through the day without napping, that's a really big quality of life change for people. And I think that kind of clues you in that maybe something else is going on. So my argument is that it's never a bad idea to talk to your doctor about it. That's what we're here for. And typically, it's as easy as getting a test for it. We just get an overnight sleep test for it. So it really is something that is typically covered by insurance. It's typically very easily done. And even if it's not positive, there's a lot of suggestions we can make to help improve sleep, regardless of if it's apnea or not.
Okay, so let's talk about those suggestions and ways to improve sleep. What everyday habits or environmental changes can adults start, let's say, right now to reduce nasal congestion, sinus flare ups, and nighttime breathing problems?
So I would be remiss if I didn't say that the very first thing and the curative step for most sleep issues is actually weight loss. And so working with the primary doctor, working with some dietitians, and even some of the newer weight loss medications can be curative for sleep apnea. And so I always talk to my patients about that. It's not a fun conversation to always have with people, but I think to do a good job, that's really the cure. I also think it means that I need to have the conversations with my patients about whether smoking is impacting their habits. If it's making their nasal congestion or sinus issues worse, that certainly can be a factor, as can alcohol. Again, no fun conversations over here. But when it comes to nasal problems and breathing, the ENTs can make a really big difference on. We can do things such as allergy testing. We can take a peek in your nose and see if there's anatomical issues that would be fixable either with surgery or with medications. And we can also work collaboratively with the allergists and the family doctors to make sure that we have a comprehensive medical plan going forward to address all of the issues.
And you talked about a team and working with people. So, which specialists usually work together for these issues? For example, primary care doctors, there's ENT, surgeons, allergists, sleep specialists. When should a patient ask to see each one, or how do those all fit together?
Great question. I would like to argue that we all work together and we all have our specialty that we're good at. In my opinion, the family doctor is always the quarterback. They're going to start that conversation about sleep and about some of the issues that you might be having, especially with blood pressure or diabetes or strokes. They're going to open that door to the conversation. And that's when some of our specialists get to take it from there. So I get to be the running back because I decided that I was going to be the running back. But when the family doctor ultimately feels like there could be a benefit from a surgery intervention, or there could be benefit from different options for sleep treatment, that's when they send them to the ear, nose, and throat doctors. From my standpoint, I also use the pulmonology team. The pulmonology team are specialists in the lungs, and they do a fantastic job of helping people sleep better and get their sleep apnea under control, and just make sure that there's nothing else going on in the lungs that we would need to be worried about as well. We really act like it's a unified airway. Everything going on in our nose and mouth happens in our lungs as well. So to get the full picture, we really need their help as well. And then my job is also to determine whether an allergist would be beneficial. Allergists help to tell us if there's an underlying source for our lung and our nasal issues. Also, they can help with some of the fatigue that people with allergies experience. And so once I have evaluated the patient and see some of the allergy signs, typically I'll get our allergists involved.
I love that. The family doctor is the quarterback. You're the running back. So I'm wondering, is the allergist the wide receiver then? Is that how we should maybe look?
That's generous, but probably.
Okay. All right. Okay. They would want to be the wide receiver,
I think so.
but okay, let's slow the roll a little bit. Okay. I love that analogy, but it's true. It is a team. And that's a great way to describe it. So I imagine many people might feel embarrassed about the snoring or wearing the CPAP mask, or feel less than, or it's a pain in the neck if you want to travel, and all those things. What do you say to patients who feel maybe ashamed or frustrated or maybe even broken because of these problems? Like, what is wrong with me? You know, that kind of a feeling.
First of all, there has been such a dynamic shift in the last probably 10 years on people, everyday people, understanding the impact that sleep actually has on their body. We're doing a better job educating them on the importance of that. Most of the time, I feel like that first encounter you have with me, my job is to tell you why it's important and then give you as many options as I can give you, and really just let you pick which is going to be the best option for you. So my job is to convince you that this has value, that weight loss or CPAP or the Inspire device or a mouth guard, all of those have value at helping you feel better. But more importantly for you and the people around you, it's going to help you live longer and healthier. And so we're not talking about strokes at a young age and heart attacks at a young age or blood thinners at a young age. And I think that really has shifted in the last couple of years. So that's a really critical conversation to have. I also think with the new Inspire device, it's been in, it's had NFL commercials. People make it look really good. My patients really like it and talk about it. I think that has pulled a little bit of the stigma away from sleep apnea because younger and younger people aren't needing to use the CPAP mask and be ashamed of sleeping with somebody that looks like they're going to fly an airplane. That has really helped as well. A lot of my patients like talking about it, and I love that they're enjoying it enough to talk to their friends about it.
Well, I think you're right. I think the perception of sleep has changed. Before it was, I'll sleep when I'm dead. Who needs sleep? I'm a doer. I'm a goer. I can survive on 5 hours of sleep. I think people are realizing their superpower is in the amount of sleep and rest and recovery they get. That is what really can fuel and energize them. And on the Inspire device, so that is something that people are, yes, we've all seen the commercials. So it sounds like that is a popular option for people. Is that correct?
I think that's a reason why most people come to me and start with me is to talk about the options. Everything I do, I compare to CPAP because CPAP is obviously the gold standard for sleep. It's the most titratable. We can make sure your sleep apnea is perfect. However, about 45% of people won't wear it or won't touch it for a lot of reasons. So that's where having other options, having an ENT evaluate for surgical options, for mouth position therapy, for the Inspire device, that's where we have value. And I feel like we can do a great job for our patients, giving them as many options to treat it as possible. But the Inspire, again, came on the scene. It's not a new device. It's certainly been out for many, many years. And they continue to upgrade it. That device is really for a certain subset of people with sleep apnea. It's not necessarily for everybody. And that's also my job, is to figure out if that will work for you. But it has been so successful at treating people with sleep apnea. People that would have not done anything about it in the past now have an avenue to do something for it. It's very well tolerated, very effective, and very easy to travel and be around people with that. There's no tubing, there's no maintenance. It's really quite easy to use.
Yeah, like you said, for a certain subset of the population, it really does offer a solution. And it's great that Columbus Community Hospital now offers that as well. So that is really, really important. So if you could boil this down for us, Dr. Jazwick, for someone listening to this, and I know a lot of people I'm just going to live with it. I'm not going to go see the doctor. What is a checklist maybe that they could use, that they could say to themselves, okay, I got to stop toughing this out. I really need to go see an ENT, a specialist about this. What would you say to them? What is that simple checklist that they could use to go, oh boy, I just checked 3 boxes. I better go see Dr. Jazwick?
My door is always open. You can always come see me. There's never a time when I will ever think that you shouldn't see me. That's my caveat. However, I do feel like there's really 2 questions that you can ask. One is, am I taking any over-the-counter medications, especially for either allergies or sinus, and are they not even working? If that's the case, then it's absolutely time to see a specialist, either myself or your primary doctor or an allergist or pulmonologist. And then my number 2 that I would say about any disease is, are these symptoms running your life? Do you feel like you cannot function during the day? Are you worried about them? Is there something that you have in the back of your mind that says, I think I should fix this? That's a great time to come see me. We can go from there. We can try and help in every way we can. But if those symptoms are running your life, that's the most important thing I can do for you, is make you feel better.
That's excellent. That's exactly what I was looking for. So if you're taking over-the-counter medications, ask yourself, are they working? Are they not working? If they're not working, that's a check. And then, are your symptoms basically running your life? And if you can answer those 2 questions, and if you're having issues with those 2, time to go see Dr. Jazwick or someone at Columbus Community Hospital. That's what it sounds like. Dr. Jazwick, thank you so much for your time today. This has been great.
It's my pleasure, Bill. I'm thankful that you had me on today. and look forward to talking to you in the future.
Absolutely. Once again, that is Dr. Lauren Jazwick. And for more information, if you want to learn more about this and get important resources, just visit columbusotolaryngology.com. That's columbusotolaryngology.com. And if you found this podcast helpful, please share it on your social channels and check out the entire podcast library for great topics of interest to you. This is Columbus Community Healthcasts. Thanks for listening.